I'm actually here at school. I'm waiting on a friend to bring me a parcel, so I've been here. So I just decided to just do a video and to explain why I love dentistry. Um, I love medicine as well too, but I realized today, especially from our examination that we had a periodontics examination, and I think I really love dentistry. Uh, so if you're in medical school or dental school, or if you are a pre-med student or a pre-dental student, there's some questions you probably ask yourself: why would I go into XYZ? So you would ask yourself, why would I go into medicine? Why would I go into dentistry? Some persons find that when they go into medicine, they might want to switch to dentistry and vice versa. And it's possible here in the Caribbean. I'm not so sure if you're able to do it in the US or the UK. So I was actually here making a list to compare and contrast, those primary school kind of essays, and trying to figure out what is it about dentistry that I really, really like. So I'm going to compare and contrast medicine and dentistry, and I'm going to tell you which ones I actually like. So, as you know, for the first and second years, you have to do your basic medical sciences. Most persons don't really enjoy basic medical sciences, but you have to do them. So after the second year for medicine, you start your clinicals. Where I went to school, we started microbe pathology, which would be anatomical pathology, chemical pathology, and then we also did immunology and hematology. I didn't leave out anything, and we did public health in our third year. And then after that, we went into our surgery, gynae and obs, peds, primary care. We also did psychiatry, anesthesiology. We had 2 rotations of medicine, 4th and 5th, 2 rotations of surgery, 4th and 5th, 2 rotations of O&G, 4th and 5th. In there was ophthalmology and ENT also. So most times we get exposed to a lot of the different specialties. We never had an oromaxillofacial surgery rotation. Some people might have got exposed to orthopedics. We did have an orthopedic rotation for like four weeks, but it wasn't really like the exposure that you would get for doing a rotation for like 3 months. We did get exposure in our internship though. So my exposure to orthopedics, neurosurgeon, and a lot of the other specialties actually came after I became a doctor. In some instances, some people might get a different feel of it. For instance, those that were trained in Jamaica might have gotten exposed to them a little bit earlier, but at the time that I went to school, cardiothoracic surgery and neurosurgery, we weren't really exposed to unless we were in anesthesia, doing the anesthesia for those specialties. So in third and fourth year for dentistry, however, third year we started periodontics. We also did evidence-based medicine, and we did operative dentistry. That was the third semester. Last semester we also did oral pathology. No, the semester before we did oral pathology. We did, I hope I didn't forget anything, occlusion, did a lot of courses, radiology, pretty much all the courses that would help you to become a better dentist. We did prosthodontics, if I got that, removable prosthodontics, and we also had an evidence-based medicine component. So a lot of the times, a lot of our work, a lot of our rotations are hands-on, especially in dentistry it's very hands-on. So in prosthodontics you're making dentures, in occlusion you're making teeth occlude after you've carved. In operative dentistry, which was this semester, you're literally working on a typodont in a simulated patient. So a lot of it's hands-on, and I think for most persons who are really good with their hands or decent with their hands, they'll enjoy dentistry, and for me that's a plus. Medicine, on the other hand, you do get to do a lot of stuff. Like for me, you get to suture wounds, whether it be using the fake skin, or you can actually use, some people use orange peels. I use orange peels at home, or you can actually get to do it in accidental emergency. You get hands-on stuff in dentistry, in medicine, but for the most part, most of medicine is observation, because it's life or death. And life or death situations, you can't have people experimenting, at critical moments. So I'm kind of realizing that I really do love dentistry, and I think I get it. I think I get dentistry. I got medicine, but I got medicine in terms of actually understanding certain things I only understood when I went on the ward as an intern. Or most persons from the UK will understand it as when they did foundation year training 1 and 2. Like everything only fell into place when I actually became a medical doctor versus when I was in a classroom. And most people that were in my class would probably admit that most times I was lost. I was able to pass an exam and to pass OSCEs, but it didn't make as much sense as it did until I became a medical doctor. So in dentistry, however, some things don't make sense. Everything's not going to make sense all the time, but the hand skills that you develop, they're challenging, and it's a every day it's something new. So when we were doing class 2 preps, it was interesting because you have to learn the different size burrs, the 245, the 330 burr. You have to learn how to hold the instruments properly, indirect vision. You have to learn how to master that. You have to learn what the uses of all of the different instruments. We were learning to do scaling. We have to learn all, the 204, we have 204S. We learn all of the gray curettes. We learn all the universal curettes, different types of curettes, the different types of scalers, how to differentiate them. Like we were literally learning, just like how I was learning for the MRCS examination, the different instruments and their uses is the same thing with dentistry. There's so many instruments, you have to learn them. You have to learn the air water syringe, the high speed, low speed, how to clean it, to keep the low speed and high speed working with lubrication oil. You have to know how to sanitize the chair. You have to know, at one point we were even using something called a matrix band and a wooden wedge to separate the teeth when we were doing preparations in our operative dentistry. So it was really interesting. So these are just some skills that I wrote down. We were learning probing, how to do probing as a dentist, especially in periodontics. It's imperative. We were learning about cleaning, how to clean teeth, which is one of our assessments. That was last Friday. We had to do cleaning. We're learning about next semester we're learning endodontics, or maybe the semester after we're learning about endodontics, which is, root canals and diagnosis of pathology. We're also going to learn oral surgery, which is extraction of teeth and little minor procedures in the mouth. Oral surgery in the Caribbean is different from oral and maxillofacial surgery, although it's the same in the US. An oral surgeon in the US is the same as an oral and maxillofacial surgeon in the US. In the Caribbean, an oral surgeon is a person who deals with mostly extractions, but an oral and maxillofacial surgeon does extractions as well as other surgical procedures. We actually made dentures. We made dentures last semester, and if that wasn't cool enough, we made full dentures and we made partial dentures. So I think even there's a component next semester where we're actually making dentures for our patients as well too. So I'm just in third year, but there's so many things that we have come into contact with as a dental student. And while I understand, while in medicine you can't really do so many things. For instance, when we were in surgery in medicine, you can probably retract, and if you're lucky, you may get to close a wound. If you're lucky. I think the most invasive thing I've ever done in medicine was probably a tap, where you were tapping a patient's abdomen who had ascites and probably suturing wounds. Other than that, and assisting in C-sections. But when we're talking assisting in C-sections, the most thing we're doing in the C-section is probably applying compression to the abdomen, pressure to the abdomen to help the baby out, and maybe a diathermy here and there with the consultant holding the forceps to the area that is bleeding, and you touch the diathermy to the back of the forceps. That's about it. While here in dentistry, you are learning. You learn by seeing first, and then afterwards you're doing. You have simulated patients, so you can learn in there as well too. It's been really an educational, a very educational journey so far, I must say. I kind of understand why dentists love what they do, because it's like you get to feel as though you're making a difference. So another thing about dentistry that I really like, which is pretty much the whole premise of this channel, is that there's some overlap with, when you specialize, there's some overlaps with other specialties. So as you know, ENT and oral and maxillofacial surgery, there's a lot of overlap. And in fact, here in the Caribbean, because there's so few oral and maxillofacial surgeons, the ENT team actually takes call for oral and maxillofacial surgery. So yeah, that's something that I only realized when I got into this specialty. So it's been a really, it's been a big eye opener when it comes to find out what's available here. So there are oral and maxillofacial surgeons, but they're not many. And even though there are so few, there's a lot of work to go around. And not only just extractions. I mean, there's so many different subspecialties of oral and maxillofacial surgery. There's craniofacial surgery, maxillofacial trauma, facial plastics. There's I think there's even a full body cosmetic surgery. You have just implantology. I mean, there's so many things. But I mean, it's really in demand. Up to when it was, I've seen up to recently, I saw the zygomatic fracture, and then today somebody messaged me about a zygomatic fracture again, an orbital fracture. So there's a demand. So yeah, right now I'm just gonna wait around until my colleague comes and drops off the parcel, and then I'm gonna go home and study for evidence-based medicine, which is on Friday, and that's my second last exam. Then I have a small practical to do, and then I'm done. But I must say, dentistry versus medicine, I love dentistry. And as I mentioned, for the reasons I've mentioned before, the hands-on is amazing. You're always doing something. There's always lab work, always something to do. So hope you love dentistry too. And I've given you a comparison between dentistry and medicine. So, and I'll give you a comparison even in the exams. So for instance, in dentistry, you have the NBDE, or National Board Dental Examination. You have the ORE examination. You have board examinations for Australia, and even here in the Caribbean, there's board examinations. Then for medicine, you have lots of exams. You have the MRCS, the ORE. You have the MRCS, the PLAB, USMLE. You also have the MCCE, which is the Canadian examination. You have the Australian examination. You have so many different examinations from a surgical point of view to try to get into those systems to study. Men's dentistry, there's only a few. I mean, every country has its own, but I mean, even Canada has its own dental examination, but for the most part, they're probably just as many, but you don't really hear much about them as much as you hear somebody saying they're going to do their boards for USMLE or PLAB. I don't really meet a lot of dentists migrating, and that's just from here in the Caribbean. I don't know why. I've been trying to find out why, but lots of doctors migrate. So that's something to think about if we're looking to choose dentistry here from if you're in the Caribbean, you want to do dentistry. I think it's probably a slightly easier to migrate or even to work abroad with a medical degree than a dental degree. I could be wrong, or maybe it's just that the dentists here are comfortable. Maybe that's it. But I find mostly doctors and nurses migrate a lot quicker than dentists. Could be wrong. Granted, there's in comparison to the number of doctors here in the Caribbean, like in this country, we're saturated. Barbados, saturated. Trinidad, saturated. Pretty much the Caribbean is saturated with doctors. Dentists, not so much. Probably 1 to 700, 800 persons. One dentist to 700 persons, or maybe more. And that's just off the top of my head because there's so few dentists. So from that point of view, your job is in demand in the Caribbean, but in terms of migrating potential or working in a foreign country, not so much. So yeah, I love dentistry. Keep posted on my channel.